doctor just told you that you need something called a TIPS procedure. Maybe you heard the word shunt. Maybe you heard stent in the liver. And maybe your first thought was, what are they going to do to my body? That is exactly the right question. And this video is going to answer it, calmly, clearly, step by step. We're going to follow three things: what enters your body, what leaves, and what stays permanently working for you. By the end, you'll understand what TIPS is, why it helps, what you'll feel, and what to watch for afterward. To understand why you need TIPS, you need to understand what's happening inside your liver right now. Think of your portal vein as a wide river. It carries blood from your intestines into your liver, where the liver processes and cleans it. In a healthy liver, that blood moves through smoothly. But cirrhosis, scarring of the liver, is like a dam building up inside. Blood can't move through the way it should. Pressure builds up behind that dam. So blood finds detour routes through smaller veins in your esophagus and stomach that aren't built for that pressure. Those are called varices. They can rupture and bleed dangerously. Extra fluid can also leak into your belly from that pressure. That's ascites. TIPS is the solution your IR team uses to break down that dam, to build a new, low-pressure pathway so blood can flow freely again. So, how do they actually do it? This is where we follow what enters. TIPS is not open surgery. Your team does not make an incision in your belly or your chest. The entire procedure is done through a small access point in your neck. Specifically, the right internal jugular vein, a large vein in your neck. With local anesthetic, a tiny access point is created. You're under sedation or anesthesia throughout. Your team keeps you comfortable and monitors you continuously. A long, flexible tube called a catheter is guided from that access point, through the vein, past the heart's right side, and into one of the hepatic veins, the veins that drain blood out of your liver. The whole time, the interventional radiologist uses live X-ray imaging, called fluoroscopy, like a moving picture inside your body, to guide every step. You won't feel the catheter moving. The radiation from this imaging is targeted and brief, and it does not stay in your body after the procedure. Now comes the most important moment of the procedure. The interventional radiologist uses a special needle passed through that catheter to make a small path directly through the liver tissue, connecting the hepatic vein to the portal vein. This creates a brand new channel, right through the middle of the dam. Contrast dye is injected to confirm the new pathway is in the right place. Some patients briefly feel warmth or flush when contrast is used. That's normal and fades quickly. Once the position is confirmed, a balloon catheter is advanced into the new channel. The balloon is gently inflated to widen the path, making room for what comes next. Now, the stent is placed. A stent is a small, cylindrical metal mesh tube, often with a smooth synthetic covering to help keep it open longer. It is expanded inside the new channel and locks into position, holding that pathway open permanently. The team does one final check with contrast imaging, confirming blood is flowing through the new shunt the way it should. And then, every catheter, wire, and balloon comes out. What enters, leaves. The tiny access point in your neck is closed with gentle pressure and a small bandage. No stitches needed. You may not even notice the site after a day or two. And this is what stays, the stent. It is now part of your body. It sits quietly inside your liver, a permanent bridge between your portal vein and your hepatic vein, a low-pressure highway that bypasses the scarred tissue. You won't feel it. It doesn't cause pain. It doesn't move. It doesn't set off airport security systems, though you can always carry a medical ID card. It simply works, every day, silently. Once the stent is in place and portal pressure falls, several things start to change. The detour veins, the varices in your esophagus and stomach, are no longer carrying the full force of that backed-up pressure. They shrink. The risk of rupture and bleeding drops significantly. The extra pressure that was driving fluid into your belly, ascites, begins to ease. Your care team will track your response carefully. TIPS doesn't fix your liver. Cirrhosis is still there. But TIPS manages the most dangerous complications of portal hypertension, and for many patients, it serves as an important bridge while waiting for a transplant. We want to talk honestly about one thing people often hear about TIPS and worry about: confusion. The liver normally filters a substance called ammonia out of the blood. After TIPS, some blood bypasses the liver through the new shunt before it can be fully processed. For some people, this can lead to hepatic encephalopathy, periods of confusion, forgetfulness, or feeling foggy. This is not a sign something went wrong. It is a known part of how TIPS works, and your team plans for it before the procedure even starts. Medications like lactulose and rifaximin can help. A low ammonia diet can help, and your team will watch for early signs at every follow-up visit. If you feel unusual confusion after your procedure, or a family member notices it, that's exactly when you call your team. They know what to do. After your procedure, you'll be monitored in a hospital unit, usually at least overnight. Your team watches your liver function, mental status, and symptoms closely in those first hours and days. For follow-up, your shunt will be checked with Doppler ultrasound, a sound wave scan, not radiation, at scheduled intervals to make sure it's still flowing well. If the stent ever narrows, it can often be corrected with another catheter-based procedure. The goal is to catch any change early before it causes problems. Your IR team stays with you on this. The procedure isn't the end of the relationship. Before you leave the hospital, your team will go over your specific instructions. But there are 3 things that always mean: call your team today. Number 1, new or worsening confusion. Feeling foggy, harder to think, or acting differently, especially in the first weeks. Number 2, any signs of bleeding. Blood and vomit, very dark or tarry stools, or feeling lightheaded without a reason. Number 3, fever or increasing pain on the right side of your belly. Don't wait and see with any of these. These are exactly the signs your team told you to report. You're not overreacting, you're following the plan. Let's bring it all together. What enters? A catheter through the vein in your neck, guided precisely into your liver under live X-ray imaging. A needle creates the new channel between your portal vein and hepatic vein. What leaves? Every tool, every wire, every catheter, out. A tiny bandage on your neck. What stays? The stent. Permanent, quiet, yours, relieving portal pressure every day. TIPS is not open surgery. It is performed by a specialist who uses imaging to work inside your body without cutting you open. Your comfort and safety are monitored throughout. The risks, including the chance of confusion afterward, are real, and your team manages them together with you. You are not facing this alone. Before your pre-procedure appointment, write down every question this raised. Your interventional radiologist wants to hear them. If this video helped you feel more prepared, share it with someone who needs it. And subscribe. Every video in this series is made for patients like you. This video is for patient education only and does not replace the advice of your medical team. Always follow the specific guidance of your doctors and nurses.